For today's skill review, we're going to go over adult synchronized cardioversion using the Zoll X series monitor. We're going to cardiovert patients that have rapid rhythms with a pulse that are unstable. What makes these patients unstable are going to be signs of poor perfusion or severe symptoms. So they're going to have an abnormally low blood pressure, poor skin signs like cool, clammy skin or diaphoresis, cyanosis, altered mental status due to poor perfusion, or if the patient has multiple severe complaints like chest pain and severe shortness of breath. We're going to cardiovert these rhythms like SVT on the monitor, AFib with RVR, which you can see now, and both of these are narrow complex tachycardias. A-flutter with RVR, which we can see on the monitor now. And also wide complex tachycardias, like VTach with a pulse, which we see on the monitor now. Always begin your patient care with a good primary assessment, ensuring your patient airway is clear and patent, and that they have good ventilatory support with oxygenation, also making sure that their circulatory system is intact. When plugging in the pads, use the appropriate connector. However, if you're using the smart pads with the CPR feedback, when you plug in the pads, the CPR feedback is automatically going to populate. There is a way of bypassing this by disconnecting the pads from the smart feedback connector and only plugging in the part of the pads that provides the electrical therapy, like demonstrated on the screen. When placing the pads, make sure you follow the manufacturer and system recommendations, whether to use anterolateral or anterior-posterior. If you're using the anterolateral placement, you may want to place the CPR smart puck, even if you aren't using it. If you're doing the anterior-posterior placement, remember the pad that traditionally goes under the left mammary or left pectoral is going to go in its normal place. The pad that goes onto the right anterior chest is actually going to be placed below the left scapula or left shoulder blade. One last thing about pad placement is that different placement of the pads has been shown to be successful when cardioverting different arrhythmias. For example, studies have shown that the anterior lateral placement has had greater success when cardioverting patients in AFib with RVR. To begin synchronized cardioversion, press the soft key next to the sync switch on the left side of the monitor. This is going to go ahead and mark the R waves on the QRS complex. It's also going to put an S above each QRS. At the top of the screen, you're going to notice the word sync with a green flashing light next to it. You're then going to want to select the energy using the soft keys on the bottom. Always use the manufacturer or system recommendations. For this demonstration, we're going to use 100 joules. You're then going to want to charge the monitor. While charging, clear all providers and combustibles from the patient. Once the monitor is charged, press and hold the shock button so the computer can correctly deliver the electricity at the correct time. Notice the energy delivered is different than the energy selected due to the monitor measuring the patient's impedance. Always reassess your patient after delivering the shock. Some final tips for synchronized cardioversion. If your patient's conscious or semi-conscious, you might want to consider administering an analgesic, pain medication, or sedative prior to cardioverting your patient. However, if your patient's experiencing a life-threatening arrhythmia, do not delay cardioversion to administer these medications. Also, make sure that the sync button is activated every time before you press the shock button. Finally, when selecting the energy, make sure you follow the manufacturer's recommendations or if your system has provided you with alternative recommendations. That's it for today's skill review. Thanks for watching. Make sure you guys click like and subscribe.